What's going on? Good morning, everybody. All right. Welcome to the Humanist Society of Greater Phoenix. My name is Alex Zigmund. I'm the president of the organization. Welcome, everybody, especially to new folks. I see a few new faces here. Raise your hand if you're here for the very first time. Wonderful. We're so glad to have you. There's a lot of people in here. If you haven't met anybody yet, trust me, you will be met shortly. One thing I wanted to mention, we did have a pretty good breakfast this morning. Am I right about that? All right. Well, we did not have Pete this morning, but we did have the amazing Kathy Pettigrew who helped us out. She is a shining light in this organization, and we also had the help of Henry. So thank you very much, Henry. Wonderful, wonderful. As we begin this meeting and getting things started, if you have a mobile, a cellular phone, please either place that on silent or otherwise turn it off. We'd greatly appreciate it out of respect for our speaker, our wonderful speaker today. I wanted to mention that we have something really cool happening this afternoon. It's called a board meeting. It's going to last a little long today, just so you know. So if you'd like to see how the sausage gets made, stick around after this meeting and, see if you'd like to sit in the gallery and let us know if we're doing the right thing or not. But I also wanted to mention one other thing. We have two famous birthdays today. The first of which is Thomas Paine. Yes. And then the other is Izzy. Happy birthday, Izzy. So at that, I do want to mention also that we've got some really cool stuff happening this year. We're going to try to increase the volume of events that we have going on. We're going to be reaching out to a little bit more to some of the other organizations in the Valley, one of which is the Interfaith Alliance, the Secular Student Alliance at ASU. We're already working kind of hand in glove with ASU Project Humanities. By the way, they are always looking for volunteers every Friday from 2 to 4 to help sort the clothing that they receive and the donations that they receive. It's only 2 hours out of your day for 1 week, out of 1 day of the week, and they really could use your help. So if you want some more information about that, please come up here. Let me know. Yes, Roger. Coats, men's shoes, backpacks, and things like, even toiletries, things like deodorants, soaps, shampoos, that sort of thing. If you don't mind going out and getting those small little 2-ounce or 4-ounce things that you travel stuff, yeah, those are great. The other thing I wanted to mention is that we do have a couple things that are going on around the building. This year, we're going to hopefully get it repainted. It's the paint's pretty badly UV damaged. We're also going to be working on getting the shed siding done. I see a nod from our property directors, and they're on it. The other thing is getting the roof repair. We just recently approved a roof repair. As you can tell, we've got a small little leak up here. So anything that you can contribute to help out with that, that'd be greatly appreciated. Speak to Roger, speak to our property directors, and they will get you hooked up. At that, I'm going to invite Mars up here for our service participation update.
Thanks so much, our president, Alex Zigmund. Going off of what Alex was saying, I just want to give a shout out for all of our fantastic members that are giving to us and all of the wonderful different ways that you do. So we have many social groups that you can join, different ways to get involved and interact with other members. And these are all member run. So for the folks that are doing debate with us, the book clubs, leaving religion discussion, we have a game night. We have a brand new kind of game night coming up in February. It's called Jackbox. It's going to be really fantastic, where we're going to come and we're going to connect to Wi-Fi and we're going to play games on our tablets and our phones and interact in different ways. It's an adults only kind of event because we're going to get a little bit saucy. Come on down and check that out. That's going to be on the third Wednesday in February, right here in the center. Also going off of what Alex was saying there about our connection with Project Humanities, it's through ASU. They do the service Saturdays. So thanks to all the members that have been going out there. They're there every other Saturday. We have folks like Jennifer and Cass, Joe, Brandon connected with us just this weekend at that event too. And those are ways that you can get involved early Saturday mornings. And as Alex mentioned, and Roger chimed in, we're looking for donations to help support that. And what happens at Service Saturdays is that folks that are experiencing homelessness can come and select items that they need, like clothing. Some folks are transitioning into getting jobs and they can find just the right pieces that they need there. We always got women's clothing, you know, we're just go through the fashion all of the time. But what we do need, if you have extras, is the men's clothing. We're going to start to put the message out there to the community with reminders and little bins set up here in the center so that we can start to collect some of those items, primarily the men's clothes, men's shoes, pants, jackets, and folks nowadays out there can really appreciate any extras that you can come by with jackets and hats and gloves with our chilly weather. Again, as all of these donations come in, they're sorted at these Friday events that Alex was speaking about. And oftentimes we can have a host that's one of our members. So Alex may have it on his schedule that he's going out to that Friday event and, you know, he'd love to see you there. Same thing with Service Saturdays. Cass and Jennifer are the ones that are there hosting that. Well, thanks again, everyone. We look forward to your input, your participation. We'd love to see those new faces and coming with that new energy so that we can continue to have different events and have a little something for everyone. Thank you all very much for being part of HSGP. Pauline, do you have a question?
Yes, essentially those types of things help, especially with like breaking up things like Tylenol, allergy medications. So those pill bottles do come in handy. So if you have old ones, empty ones that especially that are clean, yes. So thank you, Mars. We greatly appreciate it. One last thing before I pass it over to Cass and to introduce our speaker. Wanted to mention two things. As you know, I own my own small business, and I actually had a client who essentially owns a comedy club in Gilbert. And here's the cool thing about it that I forgot until just now, is that he handed me a stack of free entry for 2 adults tickets. So if any of you would like to go out and just have a good comedy night, all right, we're going to get you hooked up. Trust me. And we'll set it up for a night so that essentially it could be kind of a fundraising event for us as well. Kind of a cool thing. So the last thing I wanted to mention, and it escapes me now for some stupid reason. Yes, not enough coffee. Essentially, after that, golly, what can't I remember it? Anyway, I do remember now. I don't know why. Yes. I've got a million things in my head and not all of them are completely organized yet. So yesterday, many of us were here in the building memorializing Dr. Hal Saperstein. There are a number of memorial cards up here at our membership table. And there are also 2 books of poetry. They should be floating around somewhere. Yes, this is Hal's poetry. So if you'd like to stick around after the meeting, our board meeting starts at noon. So you got about half an hour to peruse the poetry. It's amazing, hilarious stuff. Check it out. We do miss Hal, and I miss his kind of behind the scenes leadership and his enthusiasm for especially the younger faces that we have in here this morning. So this is great. Anyway, I could talk forever, as you probably already know. Cass, come on up here and introduce our speaker.
Okay. Waiting on that cue back there. All right. Somebody keeps saying it and it's throwing me off. Oh my goodness. Hey, good morning, everybody. How we feeling today? All right. Thank you so much to all y'all that made it out here in person, and to everybody watching on the live stream, and those of you who caught it on YouTube later on. However you're spending time with us, we sure appreciate having you. If you are watching online, make sure to smash that like button, as the kids say, and subscribe to HSGP on YouTube if you're not already. And if you want to engage, feel free to leave a comment below. If you have questions during the live stream, you can drop them in the live chat and we will make them available to our presenter. We will also have a question and answer session for everybody who is here in person today too. So one way or another, you're going to get a chance to talk to our presenter today. Another way you can get involved is to come visit us at hsgp.org, and you can become a member of the Humanist Society of Greater Phoenix. We also do have a Patreon, so if you want to contribute in that way, hey, come on over. And we're on Meetup too. That's where all the fun stuff happens. Don't miss that. So today we're pretty honored. We have a pretty cool guest speaker coming out to talk to us today. Will Humble, and member. That's right. Today our guest speaker is a member of HSGP. All right, we have Will Humble, who has spent the last 35 years or so working in the field of public health, including a couple decades right here in Arizona, serving as the director of the Arizona Department of Health Services, and then also teaching as an adjunct professor for University of Arizona. But these days he keeps himself busy as the executive director of, I should know the name of the agency, I have it right here. The executive director of the Arizona Public Health Association. I wanted to make sure I get that one right. And also we are honored to be joined by Will Humble's parents are here today with us. Is that right? Yeah. Thank you guys for coming out to spend some of your Sunday with us here. And you know, thank you for bringing your son along too. So without anything further, please join me in giving a welcome back to Will Humble. Come on up, sir. Thank you.
Thanks for the invite. Hey, so I have this mobile mic, but I just used, I need to use this. Okay. Here, you turn that off.
Turn this off?
Yeah.
Okay.
Turn this. All right. Okay, thank you. Thanks for that introduction, and thanks for the invitation to come back. I did one of these a couple times, once in the mid like 2013, 2014, and then 2019 before the pandemic. We had a kind of, I think that was more of a vaccine kind of discussion. And then we did a couple of Zooms during the pandemic where we talked about what was happening surveillance wise, during the pandemic, but also a lot of public policy topics. So we had a lot of good discussions, I think, on those Zooms during the pandemic with this group. So so a couple of things I want to accomplish today. I want to spend a little bit of time on what happened in 2022, not a ton because that's things in the past, but there were really important policy decisions that were made during 2022 that are going to have a long lasting impact into the future. Some of them good and some of them bad. So this isn't all just like gloom and doom talk for 2022, because there was some good stuff, especially related to the budget that happened last year. And then I want to talk a little bit about sort of forecasting into 2023 with how it might be, a little bit about the opportunities within the executive branch that are not dependent on legislative action. A lot of people think that, if you've got a hostile legislature with respect to progressive causes and a governor who is interested in progressive stuff, that it's just going to be gridlock. But a little known secret is that there's a lot of authority within the executive branch, within these agencies, that could really make a big impact in terms of just kind of policy changes that doesn't require additional legislation. And I think the folks on Governor Hobbs's team are probably, and the new incoming directors and so forth, are thinking and will continue to think through ways that they can use their existing statutory authority to improve public health outcomes, educational outcomes, and those sorts of things. So we could talk a little bit about that. I do want to do kind of a call to action. Maybe I'll do that at the beginning instead of the end. about what you can do as an organization and individually to influence policy. And some of you will already know that stuff, but it'd be review for you, and some people might it might be new. So let me start with kind of that call to action. What is it? What are the opportunities that are out there right now for you in a non-campaign kind of way, but as a way of participating in the process to influence public policy? There's two main things, especially right now during the legislative session. Is everybody hooked up with the Arizona Secular Coalition? So like you're getting their email reminders and stuff like that. If you're not, you can sign up for their newsletters so that you'll get that in your feed. And that's really important because as the legislative session goes through, they're tracking a lot of the bills that we're interested in as humanists, and they will provide you a mechanism so that you can have your voice heard during the session. And there's two different ways you can do that, passive and active. So in a passive way, what all of you could do is to go down, if you're not already signed up on the request to speak. How many people are signed up on the request to speak? Good. It looks like at least a third of you are signed up on the acronym is RTS. But what it is a way that you can track the bills that you might be seeing from the Secular Coalition or from on my blog at the Public Health Association. You can go to that RTS system and track the various bills and see where they are. And then you can add your support. You can put your name in there. You register. You could say, this is my name. I'm in favor of this bill. I think this is a bad idea. A lot of times sometimes I put neutral, and people are like, it gets more attention than you think when you put neutral in the RTS box, because they're like, why are you neutral? So you can sign up, and then you get to say why you would be for something if it would just get tweaked a little bit. And then when a bill's coming up in front of committee, like there's the House Health and Human Services Committee has a really long agenda on Monday afternoon. You can go and actually go down to the Capitol, sign up to speak. You can sign up to ask to go to the podium, which I encourage anyone to do. You get a little bit out of your comfort zone and like talk to the committee and tell a personal story. The legislators love personal stories. A lot of times they'll get doctors and stuff that give up there and repeat data and charts and and you can see their eyes gloss over. But if you got a good story to tell about a bill, good or bad, that's what you see them sit up in their chairs and listen to. And so you can, so you can sign up for bills, or if you don't want to speak at the podium, you can add, like you get, I think about 120 characters, isn't it, in committee letters. You can write, you can't write a lot, but you can write a little bit about what's good or bad about a bill. And they all see that. They open up when you see the legislators in committee. They have all of them have their computers open, every single one of them. And they're looking inside the committee notes to see what people are saying about the various bills. And they're used to seeing lobbyists, the same names and stuff over and over there. But when they see somebody signing up that they've never heard of before, they do pay more attention to that because it's such an unusual thing. So the reason I'm bringing this up is it's a real opportunity for you as members in our organization to really jump into that public debate, sign up against or favor or neutral on bills. When it comes to committee, add your remarks about what you think. And if you feel real passionately about something, march down to the Capitol and sit in the chairs. You'll learn something. I like it. I'm a policy type of wonk guy, I guess. But and then go talk in committee. And you'd be surprised that when they call we're all called like regular people. That's what they call. If you're not a lobbyist, you're a regular person. And that's what they call them. And they do pay attention to that. So now how do you do it? Well, they kind of make it hard for you to get a login and a user ID. So what you have to do is you have to physically go down to either the House or Senate. It's like you can't go get your user ID or your login on your own on their website. You have to go down there once. Okay. Okay, maybe you can put, so that'd be a good thing to be on the HSGP website for you to go and they'll sign up for you. I guess they physically go down there for you. I could. Civic engagement beyond voting. And then Google that and civic engagement beyond voting, Arizona. And you Google that and they will set you up with your RTS. It's not a super intuitive system. There's a little learning curve to it, but you can be, if I can become proficient at it, you can too, because I'm not super good at the technical stuff. So that's one call to action I wanted to talk about. It's just during legislative session to make your voice heard that way. Another thing that you can all do, and I encourage all of you to do it if you have an interest in public policy, is to sign up with the new governor's website to volunteer for a board or commission. So there's 35 boards and commissions in Arizona of different types. Some of it's like medical licensing board, but there's also commissions on the arts, in humanities. There's all kinds of these boards and commissions that are out there. And, you know, we've had for 14 years now, we've had Republicans in the governor's tower who've been have the liberty of choosing who's on these boards and commissions. And all these boards and commissions, for the most part, they all have terms. And so as people's term ends on a commission for humanities, or let's just say for an example, those boards, those positions come open. And in the Arizona's, in the governor's office of boards and commission, they'll have your CVs or your resumes or your contact information in there. And then you can start signing up and participating on boards and commissions, because they do actually have a lot of decision-making authority, and it's a way for you to participate as a volunteer. Well, I think that you get $35 per board meeting or something. So basically you're volunteering, but you really have a chance to lend your expertise in an area, and we collectively can then start populating some of these boards and commissions with more free thinking type of people. Not that no one is now, but like there's an ideology that comes with these executive branches, and they tend to appoint people to the boards and commissions that share a similar ideology, and there's been 14 years of that. So it's important for folks to sign up. So I wanted to do a quick, holy smoke, I talked too long about that. So with that, let me just talk about some of the highlights in 2022 and lowlights, I guess. Then we'll talk about 2023. And then I think probably the best discussions we're going to have are be about questions that you all might have. And nothing's off the table. If I don't know the answer, that's what I'll say. But I'm not shy about opining on different topics related to public health and stuff. So I'm going to just focus more on, I don't want to focus so much on like what happened with the pandemic and with, surveillance and things like that. I think I'm going to focus more on some of the policy things that happened last year that you may or may not be familiar with. One thing I wanted to cover is, it is pandemic related, goes back into March of 2022. So the public health emergency was declared by the governor back in March of 2020. And he kept that public health emergency in place for about 2 years. He ended that public health emergency in March of 2022. And quite honestly, I was in favor of ending the public health emergency at the state level. You might say, why would that be? And that just my opinion is, from really all the way through 2021 into 2022, the governor was using that public health emergency authority mostly to preempt local jurisdictions from doing something. So instead of using that public health emergency authority for assertive public health measures, as happened at the beginning in March and April of 2020 and in the summer of 2020, a lot of that, he was, in my opinion, this is my opinion, misusing that public health emergency authority to tell cities, counties, and schools what they can and what they can't do. Not what they must do, but what they can't do. So, for example, there was the prohibitions on, you can go look at those executive orders. Maybe the website's pulled down now since he's no longer in office, but it's probably in an archive somewhere. I mean, these were executive orders that said cities can't do the following: require masks, require vaccines, things like that. There was just a host of things that he was using that authority to preempt locals from doing. And so I embraced the end of that public health emergency, mainly because it wasn't being used for productive purposes. It was being used for, by and large, at that point, harmful things, because it prevented cities from doing stuff. Now, having said that, most cities by then, because the vaccine had been out, for a year and a half now, by March of 2022, most of those measures, there was no city councils, and schools were no longer interested in those things. And so that public health emergency authority ended back in March. So I wanted to just sort of remind people about that. Something came up in April that probably most of you never heard about. I tried to get some journalists to write stories about it. I think Stephanie Innes at the Republic did write a little piece about it, but it never really got prominent publishing in the Republic. And that is, has everybody heard of the Auditor General's? So in state government, not the Attorney General, that's a separate thing. In state government, there's something called the Auditor General, and it's an arm actually of the state legislature. And it's designed to be a watchdog over the executive branch agencies. And they've got a really talented, Lindsay Perry is the name of the person who's the head of the Auditor General's office in Arizona, super talented. And she's got some really smart folks that work for her. And their job is to look inside of the state agencies and evaluate their performance. Something that you may not have heard about, and I think this borders on criminal misconduct, that's just my opinion, is the Auditor Generals, they looked at my former agency, the State Health Department, who is responsible for licensing and regulating nursing homes. And so, when there's hundreds of nursing homes across the state, regulated by the State Health Department, and when there's complaints that come in, when somebody's loved one is in a nursing home and they use the substandard care or what appears to be substandard care, or they're not, you can tell that they're not doing things properly, you file a complaint with the State Health Department. And the idea is that they would go out and do an investigation and figure out what's happening and come in there with a clipboard and try to figure out like what's going on at the nursing home. And what the Auditor General's report in April found is that there were hundreds, thousands actually, of uninvestigated complaints at nursing homes going back. Actually, let me start back. It goes back to 2019. The first Auditor General report found that the State Health Department was not following up on complaints at nursing homes and gave them a list of things that they needed to correct in order to get the house back in order. And doing what they're statutorily obligated to do with regulating nursing homes. And this Auditor General report in April of 2022 found that not only did the State Health Department not correct that, not only did they not start investigating and following up on complaints at nursing homes, they took in order to meet the performance measures that the Auditor General urged them to meet, they reclassified all of the high-risk complaints. So there's things like pressure ulcers and chemical restraints, like medicating people too much and things like that. The State Health Department took the high-risk complaints and called them low. Well, a high-risk complaint means that you need to follow up within 10 days by law. A low-risk complaint, you have a whole year. So they took 98% of all of the high-risk complaints and reclassified them as low-risk complaints. Therefore, we're meeting our performance measures because now we have a whole year to follow up on these things. 98% of all the high-risk complaints were reclassified as low. There was a hearing down at the state legislature, a joint House and Senate. Both parties, legislators, were pissed about this whole thing. And I know a lot of journalists. I tried to get them to I don't know why no one was interested in following up on this thing. So I like to tell groups like this about what really happened. Now, they are in the process of righting the ship. They've hired some people. The people that were responsible for what I think is criminal misconduct, reclassifying something that's high risk as low just to meet the time frame. Those people now work at Blue Cross Blue Shield. So they're no longer in a position where they can make decisions like that. The new people who I do know are really working hard to right the ship. They're hiring people. They're no longer, they're not meeting the performance measures, but at least they're being honest about what they're not able yet to do. So I like telling that story because I just never made it in. I saw some shaking heads, so some of you knew that story. That was something that happened in April, and then there were some things that happened in April and May, and I believe me, I will get to some good stuff. April and May is a period of time in the last legislative session where the legislature kept passing preemptive laws that preempt local jurisdiction from doing various different things. And the motivation for these bills has to do mostly with things that happened during the pandemic. So one of these laws I think is potentially more harmful than the others, which is was called Senate Bill 1009. This is a law. So it's a law that changes future governors, like Governor Hobbs now will have far less public health emergency authority than Governor Ducey had. And Governor Ducey enjoyed almost 700 days of public health emergency authority. He misused that authority for much of it, in my opinion, to harm the response. But that public health emergency authority was open-ended, so that you declare it by executive order. The public health emergency stays until the governor decides that the emergency ends. After Senate Bill 1009, which passed and Governor Ducey signed, he signed it making sure that it didn't take effect until after he left, January 2nd of this year. It limits public health emergency authority in the future to just 120 days. Now, it can be extended if the legislature in 30-day increments. So the legislature would have to keep coming back and reauthorizing the public health emergency for a maximum of 30-day intervals. So they'd have to keep coming back. So if we're ever in a position, and hopefully it won't happen in any of our lifetimes, but it could, where we have another public health emergency where additional authority is needed to make responsible decisions to save lives, that authority will end after 120 days for future governors. There were a few other bills that the legislature passed and that Governor Ducey signed that changed the landscape. I don't think anything is as harmful as 1009, potentially harmful as 1009 is. One of them that I really don't like is House Bill 2616, which permanently takes away the ability of county health departments to require universal masking in classrooms. And even not in a public health emergency. So for example, let's say you have a measles or a mumps outbreak in a classroom because of the declining vaccination rates that we have in Arizona, then you'd have a situation where the county health department might decide, look, we want to keep in-person instruction, it's very valuable, but for a period of time, we're going to ask the students to universal masking, to keep the particles from coming into the air, so that we can keep in-person instruction going. That is no longer, it's that after this bill, that's no longer the case. You can't have, that's been preempted now by state law. That was 2616. And that's now in effect. Let's see. 2453 prevents any political subdivision from requiring anybody to wear a face covering on the government premises. There's another one that prohibits the state health department from ever adding the COVID-19 vaccine to the school required list. They wouldn't have done that anyway, so that's not a horrible one. And it's limited to COVID-19. But what we are already seeing this session is bills that would erode the state health department's ability to require any new vaccines for school attendance. That hasn't passed yet, and I know that Governor Hobbs would veto that if it came to her desk. Let's see. Well, anyway, you get the idea. There were a few others that passed that really do a lot of preemption. And I have a whole PowerPoint that I'm giving actually next week, even at the Rural Health Policy Conference. I have a PowerPoint on those exact bills. Now, the good thing. So I think a good thing that came out of last legislative session is what happened with the state budget. And most of you already know, what happened really was that there were enough Republican legislators that were just like, we're not interested in any new spending in, on the state budget, and we're going to be a no on the budget, such that in order to get the budget through, it had to be bipartisan. So this last legislative session was the first bipartisan budget since Napolitano was governor. It's been 14 years since the minority party had an ability to really substantially influence the state budget. And you see, when you look at the budget that was passed last year, you can really see a big difference in terms of what the spending priorities are within that state budget, especially when it additional housing into the state housing fund. And we don't have time to talk about affordable housing here today, but super important public health topic. An additional whole bunch of money that will go into the network of providers that help people with developmental disabilities. There's a lot of turnover with the staff, so there's some new staff funding to raise the salaries of people, the care workers in the DD group homes and at the day programs for people with disabilities. I'm not going to go through the whole budget, but like it is a remarkable difference this last year when compared to previous years, because we had the good fortune of you had to have a bipartisan budget if it was going to pass last year. And I think we can look forward to, for the next 4 years at least, it's be like the Napolitano era, where it's going to have to be a bipartisan budget, because she has the power, she can veto and say, I'm not signing this budget. And so I know that many of the minority party, the Democratic legislators are looking forward to actually being able to participate in the budgetary process in the upcoming year. So that is a good thing that happened last year. Let's see. The rest of this is stuff I know I want to get to the Q&A. Let me talk about the appointees real quick. So one of the things the governor gets to do is to hire the directors of the state agencies. And some of these are really, like I talked about at the beginning, these directors have a lot of authority and a lot of decision-making ability that doesn't require legislative action. And depending on who you hire for these state agencies, you can have very different kinds of priorities. For example, Access, the state Medicaid agency, the director of Access has wide-ranging ability to decide what it is that they're willing to pay for the Medicaid members. One of the things I'm looking forward to in the next year or two is Access actually not requiring legislative action. Just the Access director, who her name is Carmen Heredia. She's been nominated by Governor Hobbs to take over the Medicaid agency, and she's already started, actually. She started last week. I'm looking forward to them saying, hey, look, we're going to start paying for community health workers inside the Medicaid program. And if those of you don't know who community health workers are, they're sort of I look at them as the real grassroots health workers. They're folks who come into people's homes, talk to them about chronic disease self-management, talk to them about, a healthy diet so that they can maintain and do better with if they have type 2 diabetes without needing insulin. They're like, I think of them as really health coaches. Very important way of improving health outcomes. Well, that wasn't going to happen under the previous administration, but I expect the Hobbs administration to say, look, there's a good evidence that this type of health worker really improves health outcomes. And I expect to see access in the coming year start reimbursing for community health workers. Doulas is another category of health worker. Doulas are they're like birthing coaches. It's not exactly what they are, but they're kind of birth coaches. So a mom, when she's going through pregnancy, will meet with doulas and have meetings over and over again and talk about the birthing process and learn about the breathing techniques and all the other things that go along with having a healthy birth. And then the doulas, if it's a hospital birth, the doula will be invited into the hospital and sort of be there as the advocate coach and so forth for mom. And there's good evidence that doulas both reduce birthing costs because you have fewer C-sections and improve the birth outcomes. And I know that there's support within the Hobbs administration, and I think Carmen Heredia, who's going to be running Access, I just want to highlight those as like some things an agency directors can do that doesn't need legislative action. They just make a decision. This is going to be in the covered services guide. This is going to be the reimbursement rate. Since it's budget neutral, we don't have to ask for more money because both community health workers and doulas save money. They have a salary, but the overall capitated system is going to have less costs in it because they're keeping people on diabetes, for example, from not having repeat trips to the emergency department, et cetera. And with the example of doulas, fewer interventions like C-sections, which are bad for mom, but also more expensive for the system. So I'm looking forward to some changes in the access system and just being more open-minded about what it is that they will be interested in paying for within that system. The person who has been nominated to take over the state health department is Dr. Theresa Cullen. And when I talked to the transition team during, in December and stuff, they had a list of like 15 names for that agency position. And I said, look, if you can get Dr. Cullen, she would be a really good choice. That's if you can get her, but she lives in Tucson. It's kind of a problem, people don't want to relocate, especially Tucson people. They don't like coming up here. But she said yes. So I'm really pleased that she said yes. One of the things I've known Theresa for a while, and she has a very strong personality. And I knew that my advice to her was, look, before you say yes to the job, make sure you actually talk to the governor and tell her what your gotta haves are. And it wasn't a long list. Her gotta have was, I need autonomy. Like, I need to be able to actually make decisions and not get directive from the governor's office on what we're going to do, not do. Now, keeping the communication open is one thing, but she wanted to ensure that she would be able to actually make the decisions. And the reason I like to tell that story is it shows you what kind of a leader Governor Hobbs is going to be, that's not micromanagement. And by the way, I worked for Brewer and she left me alone, which I really liked. Like, I did not get micromanaged from her. So it's not an ideology thing. It's like a management practice. And my opinion is the best management practice is to hire talented people and let them do their jobs. That was not the case over the last 8 years. there was a lot more directive coming from the 8th and 9th floor on terms of telling agency directors what they should and shouldn't do. So I like a decentralized leadership model, and that when Dr. Cullen talked to the governor about that, I think it made me think good because, for someone to say that, and the governor said, yes, we want people to take ownership of the decision. That's to me a good thing. Let's see. I wanted to cover those. I think I've covered most of the high points, and we still have we have 15 minutes, just like we said at the beginning. So
all right.
He's got a mic.
Okay, so we're going to start the question and answer period here. So if you're online and you're watching this and you want to submit a question, feel free to leave it in the live chat and we will get to them as they come. Also want to remind everybody watching online to make sure to subscribe and head on over to hsgp.org to check out what we're up to and become a member if you're not already, and join us on Meetup. So with that, let's go ahead and get on down to the questions. This was the first hand I saw, so we'll come over here first.
Thank you. After the change that the Auditor General made in allowing nursing homes 1 year to deal with complaints, has there been any analysis of the number of deaths resulting in that change?
So the question, they can hear online the question, right? Not that I know of. So that I don't know of any like surveillance on terms of that kind of outcomes that you're talking about.
Because 1 year for an elderly person is a very long time.
Yeah. I can say that I know somebody in the licensing division of the state who sent me they have graphs and pie charts and stuff already where they're tracking the improvements in terms of getting out there and doing the complaint investigation. So I'm confident that things are getting better, but if you go to the state jobs website, you can still see they have a whole bunch of jobs open. And a lot of these positions require an RN. Because, you pull the charts and you got to know what you're looking for when you're doing it's not like a restaurant inspection or something, it's more complicated. So they are having challenges getting, the kind of staff that they need to be able to not just do windshield type of complaint investigations where it's easy to go out and say no deficiencies. It's much harder to do a complaint investigation where what it is that you're supposed to look for, what you need to see, and what questions to ask. That's how you're going to identify deficiencies that then end up in a plan of correction.
All righty, so we got more questions. I see another hand over here, so let's head on over this way.
Will, would you care to comment on what you see as the prospects for death with dignity kind of legislation in the coming years?
Good question. I have worked with that coalition the last couple of years. I think it kind of, I don't know. I don't honestly know. I can say that I do see that there are potential strategies that can work. And the reason I say that is that often, regardless of party, often what you'll see at the state legislature is individual legislators championing causes where they have a personal connection. So you can often see lawmakers who typically you wouldn't think they're interested in providing better services for people with serious mental illness, but they're actually that's one of their top priorities. And it's usually because they have a family member where they see the inadequacies in the system and want to change things regardless, with outside of the politics of things. So I think the key to success with that is identifying lawmakers who have personally experienced a bad end-of-life outcome where a person's ability to make a decision that they want was impaired and how that made them suffer, and not just them, but the rest of their family suffer unnecessarily. and getting those lawmakers to champion. So I think it's actually a doable thing. I do think it's a doable thing, but it's going to take a lawmaker who feels passionately about it, and that will most likely come out of a lived experience.
Oh, there it is. Oh, okay. We'll get to you. We're going to come over here first, and then we'll be over that way. All right.
Hi. We have had in the last few years a decline in lifespan in the United States. And is that being affected by people who are refusing to get vaccinated?
So yeah, what you're describing is 100% true. In fact, Arizona had the biggest decline in life expectancy of any state over the last 2 years. We have the report. The report is on, it's on the azpha.org website. It's at the bottom of this is a CDC report. There's two factors. The biggest, of course, being deaths from COVID-19 across the board. The decline in life expectancy on the Navajo Nation was 7 years. They're 5% of the population. So that doesn't explain Arizona's bad numbers because it's just 5% of the population. But in Navajo and Hopi, it was 7. The decline in Arizona as a whole was 2.8 years reduced life expectancy, mostly attributable to deaths from COVID-19. By the way, Arizona had also the highest per capita death rate from COVID-19 of all 50 states. We passed Mississippi about a month ago. And biggest decline in life expectancy, most deaths per capita from COVID-19. And then the third category is, the COVID-19 metrics, one thing. Another chunk is in life expectancy decline is really this fentanyl problem. Because if you think about, not exclusively, but COVID-19 was going mostly for elderly people. So the life expectancy changes in that cohort weren't that dramatic in terms of, because they were already older. But fentanyl is killing people in their 30s and stuff. And so you see, when you have a death in that cohort, it brings the life expectancy down more. There's no easy answers for this fentanyl thing. Senator Marsh had a bill 2 years ago that legalized fentanyl test strips. Narcan, which all young people should have in their purse, wallet, car, in places, is a really fast-acting reversal for opioid poisonings, and it works almost immediately. But you have to have the Narcan with you right then because the people are stopping breathing. So Narcan is available. We need to make that more widely available. So it's really those two things. I heard somebody mention suicide. That's not. Suicide's actually in Arizona decreased during the pandemic era. So.
Is this, there it goes. All right, we got a question over here, and then we're going to go to one from online.
I had a question regarding the effects of mental health overall as a state with being shut down and all that sort of thing, and people being isolated. I've heard that there's potential long-term effects, from that shutdown, and especially conceptually like children being out of school,
right?
Especially young children. Has there been any studies relating what is the long-term effects that potentially is going to be from a public health standpoint? And is there any legislation that has happened or is going to be happening to help kind of address that challenge?
So I know that there are studies underway, and because it's now only been just a year and a half, 2 years, So I know that there are studies that are prospective studies that are going to be measuring that over time, both not just that, but learning loss, but also the social and emotional learning that was lost because of the lack of social interactions. And so I know those studies are underway, and it's yet to be determined, because you said long-term, and we don't have long-term yet, but the research is happening, it's funded, and it's underway, but that I don't know of what those early results are yet, because usually they won't, like, you'll know, if you're the PI on the grant, you'll know what the early results are, but you don't publish it until you know you got something that you can get into the journal. So I think we'll be learning more about that, but undoubtedly, for sure, impacts. And then the question becomes, what are the interventions? What kind of interventions, more school counselors, things like that, for sure. There's other evidence. I'm not an education expert, but anyway, good question.
Alrighty, we got a question online from RJ that says, will please share the 3 priorities that AZPHA selected for 2023, and also please briefly discuss this year's theme for the annual conference.
Okay, RJ is one of my members, I can tell. That's RJ Shannon, I know. Thank you, RJ. We miss you. You should be down here. Our 3 major, so I'm with the Arizona Public Health Association. I'm the executive director. I have a board of directors. I'm the only employee. We have 3 main priorities, and we set each year. And I wanted to take some time to spend on one in particular. Clean energy is one of the things, but I think what the reasons RJ is getting to is firearm violence is one of our main priorities for this year. And so what we've done, and you'll see our report coming out in about a month. We found a really talented intern, doctoral student who's working on doing a firearm surveillance report for Arizona, looking at mortality and injuries from firearms in Arizona. That kind of state health department has not done any of that kind of surveillance, but we have access to the data. So we're like, we're going to spend some money, hire an intern, and we've got her and one of our talented epidemiologist members, Alan Williams and Julia Jackman, are putting this report together that's going to dive into the details of mortality from firearm violence. But importantly, the second part of that report is really an evidence review to show what kinds of evidence-based policy interventions are effective at preventing those kinds of firearm injuries and deaths. Things like red flag laws, licensing provisions for firearms and waiting periods, things like that, things that have been proven in various different categories. And so we're publishing that report at the end of February. And we're hoping to get and I'm going to give an advanced copy to some journalists and the governor's office and so forth, and Gabby Gifford's organization down in Tucson, so that we can get a more public discussion about this. Not that I expect to see legislation coming out of this legislature on these topics, but it's important to get the surveillance data out there and the evidence review, so that I think of these things as a long-term, mid to long-term kind of investment, where there will be a moment in time, I think, in the state legislature where we can embrace some of these policy decisions. I don't think it's something that's going to happen in the near future. So, that's one of our, I think that's one of the 3 priorities we have. That's the one I think that's our signature event this year. Our conference that RJ mentioned is on February 23rd, and it's about reducing health disparities. We've invited it's up on my blog right now, a host of folks who will be coming out who are working at the county health departments on health disparities grants. And they'll be sharing the best practices, some of the early results that they've been achieving in a whole bunch of different varied areas. And you can go to the website and look at the themes that we have. Fortunately, we have Maricopa County Public Health is offering scholarships. And so normally these conferences cost $225, but Maricopa County is offering scholarships. So if you're interested, take a look at the agenda. And if you're really interested in going, the scholarship code's right up there, and you can attend our conference. It's at the Desert Willow Conference Center over here on the 23rd, which is a Thursday of February. Yeah.
Okay, we have any more questions from the in-person? All righty, we can come over here. Excuse me.
It hadn't occurred to me before until we were just talking that the increased isolation caused by COVID might have an influence on firearms usage. And I wonder if anybody is investigating that. Do you understand what I'm
Yeah.
saying?
So I'll have to look at you know what, they're writing the report and I'm sort of reviewing it a little bit, but I haven't gone any in depth yet. So I don't know if how much our report's going to shed light on that. I will say that if you look at the category suicides, that was most causes of mortality went up during the pandemic. So diabetes 2, for example, deaths from type 2 diabetes went up substantially, probably from lack of either management or care, not, or showing up to the ED and being sent away, things like that during some of those surges. Most injuries and accidents were up substantially. Suicides were down.
What?
Firearm violence. Yeah. So we're going to have trend lines in the report. Now, we're not going to be able to attribute, like what the surveillance report's going to do is to say, this is what we have observed. Being able to attribute that to something is a different matter.
In general.
Yeah.
Okay.
So we're just, I don't want to oversell. We're not going to be able to attribute the increase to certain things, but we can establish that it in fact exists.
Okay. Any more questions from?
Yeah.
Okay. All right. I actually had a question for you. I wanted to play a little bit of a advocate of the other side here, because comment that you made earlier, in your opinion, you mentioned that there was a new law that has gone into effect that limits how long a governor can declare a public health emergency without having to go back to the legislature every 30 days to get that emergency reauthorized. Why do you feel like that is a step in the wrong direction? And an advocate of that might say, we shouldn't give governors that unlimited, unchecked power. They should have to report to the representatives of the people in the state legislature. So why is that a step in the wrong direction in your estimation?
So I will say that in the RTS system, that I signed up neutral on that bill for that reason, which is you never know who you're going to get during a public health emergency. So if you have, for example, a governor who would use that public health emergency wisely and to improve outcomes and save lives, then you would say, I want that governor to have more authority. But if you have a different kind of governor who uses the authority to harm the response, then you're like, we would have been better off with 120 days instead of 700. So you have a total point, and the problem is you can never see into the future. And I do agree that you should have checks and balances in the system. So I will, if I could go back in time, I would temper my earlier remarks. Because it might actually be good policy, but we won't know that until the time comes.
And the final thing I wanted to ask about is just a general, how can people stay informed, stay up to date on what's going on, maybe interact with your organization And then just in general, get involved and participate in this process. You've talked about it a bit. I just want to make sure that we don't miss anything.
Right. So first thing is, for a group like this, make sure that when you go home to sign up for the Secular Coalition of Arizona's newsletter, so that you get that in your inbox I don't know if they do that regularly, but you'll see it during session. Okay, there's something coming up on this bill or that bill. So that's one thing that you can do. If my area is public health, so we've got our blog, my blog, which and when I go home tonight, this afternoon, I put it out on Sundays. I got to go write my newsletter for my members. And then it'll go up on the blog with like the forecast of what's happening next week down at the legislature for various bills. So you can stay informed that way. Volunteer for a board and commission. I talked about that up front. Get signed up for the RTS system, like what we described at the beginning. So those are just some examples. And then are we ready to wrap?
Just about.
I just want people to know that Diane Post is a member at HSGP, has been a member for a long time, and she writes a weekly thing for Secular Coalition for Arizona. And this time it's a little different. You have to open each thing. One is LGBTQ, one is other things, but she tells us whether we should oppose or support the bills that are being introduced at the legislature, and why. And so you can add the comments from her. She's very, very good. She goes along with the CEBV weekly that also you can get for free, that lists all the bills and why you should support or oppose them. Took me an hour this morning.
All right, HSGP, let's give it up one more time for Will Humble. Thank you so much.
Thanks for the invitation.
Thank you so much for coming out and hanging out with us today. And for those of you joining us online, make sure that you take time to drop a like, leave in a polite and respectful comment if you wish to engage on this. Visit us at hsgp.org to become a member. Check us out on Meetup if you want to be part of events like this and other cool, fun, and meaningful stuff that we do. And finally, just make sure you take time out of your day to do something nice for somebody today, because after all, that's what being a humanist is all about, right? Thanks, everybody. You ain't done yet. Alex got the mic.
Are we offline? Okay. I believe the cameras are off, so I won't embarrass myself too much to the world. Again, thank you everybody for coming, especially for the new folks. Please